All right, Dr. Joannou, welcome to the Easy Conversations podcast. Thank you for joining me today. I'm really excited to cover the topic we're going to discuss for many reasons. But before we jump into it, I do want to give you an opportunity to share with the listeners a little bit about yourself and what's brought you here and some of the work that you're actually doing right now.
Oh, fair enough. Furkan, thanks for having me on. I've been a Western trained doctor for the last 45 years, most of that time in general practice. And 25 years ago, I also learned acupuncture because of the journey I was on where Western medicine wasn't helping me. In particular, it was a problem with Crohn's disease where I had surgery, 2 feet of intestine cut out. And then when I was about to leave hospital, I asked the surgeon what diet I should follow. And he said, eat anything you like, you're cured. And so I did. But within 6 weeks, I started getting symptoms of the Crohn's again. So there was no way I wanted further surgery. So that began my journey of exploration to find out what else was available. And led to me down the road to acupuncture and Chinese medicine.
Mm-hmm. Yeah, well, thank you for sharing that. And I think one of the things that's become a bit of a theme on this podcast, I've covered it a few times, but Western medicine, for all the benefits we derive from it, often we tend to use it as more of a reactive form of approach, whereas some of the other things that were from the eastern part of the world that we've come to understand. Ayurvedic, for example, is another form of medicine that I'll be covering on this podcast. But acupuncture or Chinese medicine, as you touched on, can sometimes be more proactive. Is that kind of what you've come to observe as well, based on being a part of?
Yeah, absolutely. I mean, Western medicine is fantastic as emergency stuff, where acute illness like pneumonia or acute injury where you need life-saving surgery, that sort of thing. There's no equal to that. But in terms of chronic problems, which, a huge part of medicine today is managing chronic problems like arthritis and heart disease and all sorts of issues, obesity and so on. And Western medicine, the approach is to have a drug to fix the problem, but if you're not actually changing anything about your lifestyle or, the foundations, then, nothing's really going to change. It's just band-aiding the problem.
Mm-hmm. Yeah.
I was going to say that, the Eastern medicines and concepts really are based on balance, function of organs rather than looking for pathology. You're looking to just getting things in an optimal state so that the organs can do what they're supposed to do.
Mm-hmm. Yeah, and I think, as you were touching on the Band-Aid solution with Western medicine, you kind of see people in the Western world living their life like that too. Right? Not focusing on their behaviors, not focusing on their diet per se, and almost doing again, reactive approach to their health.
Yeah.
And one of the other things I've come to at least understand, obviously I want to get your view on it too, but when you're going to medical school, you're not really learning about some of these proactive approaches or focusing on some of the even just the diet piece or health, for example. So it's not being taught, which can be problematic, right? So when you go to see a doctor and you've been struggling with chronic pain, they'll almost try to troubleshoot it and not really know what's the root of the problem.
Well, that's right. I mean, my medical history, education was 6 years of 5 years at a university and a year as in it doing an internship. In the whole of that time, the amount of time I was taught nutrition amounted to 1 hour. 1 hour out of 6 years was devoted to nutrition. I mean, that's just insane, really.
Yeah. And do you think that's changed over time, or it's still the same?
Unfortunately, I don't think it's changed.
Yeah.
But judging by the registrars because I teach doctors who are becoming GPs, and I haven't seen a change in all that time.
Yeah, well, so let's perhaps shift directions a little bit. Let's
Mm,
expand on the Chinese medicine or acupuncture for that matter. What is
mm.
so unique about this approach and why is it not fully adopted yet? So obviously
Yeah,
Chinese
yeah.
is here, but yeah,
Well, the thing, yeah, it's a really good question because with acupuncture, I mean, and the thing I love about it is you're not introducing anything, a foreign substance to the person. You're not giving them a drug or a supplement or a vitamin or anything like that. It's just purely the body rebalancing itself based on where you're sticking needles in. If you think of the meridians as energy pathways, and there's areas that are getting blocked or there's excess energy, and you put a needle in and that brings it back to a normal state, then the body can just happily do what it's designed to do without any further intervention. I mean, there's nothing magical about it, but it seems like magic from the responses I get from people. It
yeah,
never ceases to thrill me. And specifically, I've developed a system that uses the Chinese system of acupuncture to manipulate chakra energy, which is based on the Hindu system, and that works marvelously well. And I sort of first observed this when having patients with low back pain, and I decided to try treating them this way using the acupuncture to think about, okay, well, what happens if they're getting low back pain all the time because they got problems with the root chakra and the second chakra. So I was needling those points, and not only did their back pain improve, um, people who had been seeing me over the years for chronic back pain had got much stronger and much longer lasting effects, benefits from it. So
yeah,
that sort of started me on the path of thinking, okay, there's a connection between the mind and the body and the spirit, and and that sort of really hit home. This is now 2011, where I was treating a woman who had widespread osteoarthritis. It was affecting her hands, her hips, and her knees, and she had to go onto opioids because the pain wasn't controlled by milder medications. This was by another doctor in the practice. But she didn't like the effects the opioids were having on her, making her drowsy and nauseous. So she came to see me, and within 3 weeks, she was able to stop the opioids and only just need the odd Tylenol for the pain. But after about a couple of months, she asked me if she could stop her antidepressants. And I found out she had been taking them for 16 years. And I thought, well, maybe she just didn't really need them. She just kept taking them because the doctor kept prescribing them. But I checked through the records, and her doctor had tried had stopped her medication the year before. But within 6 weeks, all the symptoms of depression came back. But this time, not only did the symptoms of depression not come back, but she actually felt a sense of joy and happiness. And that really hit home when because this was around Christmas time. She had a knock on the door and opened it, and it was a group of Christmas carolers singing to her. And she burst into tears, and she just felt like her heart was swelling with joy and happiness. And she said she hadn't felt anything like that for years and years because the antidepressants not only blunt the negative emotions, I think they blunt the positive emotions too, which is good if you're feeling suicidal to feel less suicidal and less depressed. But it's not good if you can't experience the joys and happiness. Well, as I said, that was in 2011, and she still sees her GP in the practice, and she still doesn't need antidepressants, and she still hasn't been on any opioids.
yeah. No, that's a great story, and I
Yeah,
think first of all, for a lot of people, what I think on the surface can be there can be resistance around acupuncture is just the whole idea of getting needles put into you, right?
yeah,
So,
It's interesting. It's nothing like when you have a blood test, for example. A blood test, the needle has a beveled edge. It's sharp, very sharp. So the idea is it cuts into the tissue to cut into the wall of the blood vessel to drain the blood. And similarly, when you have a vaccination or injection of some kind. But with acupuncture needles, the actual tips of them are rounded, they're blunt, and they're very fine. So when you insert them, they tend to push the nerves and blood vessels to one side or the other, which is why, one, you don't feel pain because it's not cutting anything. And secondly, when you take it out, there's 9 times out of 10 or more, there's no sign of blood either because you haven't actually cut a blood vessel.
right,
So, the sensation is minimal to mild. I get some people who are very dubious about the thing, and I say, well, just let me put one needle in, and if you don't like it, I'll take it out. And as soon as I put it in, they say, oh, have you done it already? Oh, that was nothing.
yeah.
Go ahead and do the rest.
Well, and the needles are pretty small too, right? For the
Very
most
fine,
part.
yes.
Yeah,
They're not much. Some of them are not much thicker than a human hair,
yeah,
so they're very
exactly.
fine.
Yeah, and then the other piece around, I do want to come back to the chakra piece, but one of the things I
Mm-hmm.
was sitting through a kind of an informational session around acupuncture, and they were talking about how even different parts of the body can be looked upon as the brain, right? Like the ear, you can look at the ear,
Yes.
find different points. Are you able to expand on that a little bit? Because I'm not obviously well
Yeah,
versed.
yeah. It's sort of a mapping of the body. They talk about each point is like a hologram of the body, so
Mhm.
that it sort of mirrors what's going on. I mean, anybody who's been for a foot massage knows that there's various points on the sole of the foot that represents various organs, and so on. And the same with iridology when you're looking at the iris, that various parts of the eye is representing various parts of the body, and similarly with the ear. And yeah, that's it's an interesting concept because I've had patients that had bit of a frozen shoulder and was causing a lot of pain to move it, and I just found a point in his shin and needled it, and then he just suddenly goes, "Oh, the pain's gone," and he's just laughing because it's unbelievable. And he comes
Yeah,
back every so often when he's got a bit of pain with it, and he comes in and I needle it, and within 30 seconds the pain's gone, and he just can't believe it.
yeah,
And
yeah.
yet, from a Western medical viewpoint, there's no connection between the shin and the shoulder.
Yeah. Well, that's, I mean, that I thought was very fascinating, the mapping piece that you touched on there.
Yeah.
And even different parts of your body there can be like multiplicity there, right? In terms of the mapping.
Yes. Yeah. Yeah. Exactly.
So how did, like in that instance with the individual that came with the shoulder pain, how did you know the shin would be the right place as opposed to somewhere else?
Well, the Chinese discovered that a couple of millennia ago. Basically, that at that particular point, and it's an easy point to find. So needling it is it's if somebody comes in, always try that just to see if it gets rid of the pain,
Yeah.
and
Yeah.
more often than not, it does. But yeah, it's a whole fascinating question. Did have another guy with shoulder pain, and I was needling him, and when I hit a certain point, he burst into tears. And then he said, because he was on holiday from Fiji to Australia, and he said that he was suddenly crying because he recalled that he was helping his father build a bure, which is a sort of a shack made out of wood, timber, and he was holding one of the beams his father asked him to hold, and it slipped and he fell and landed on his shoulder, and he felt so ashamed that he wasn't, man enough to help his father, that he was literally carrying the pain and shame on his shoulder. For this was like a couple of years later when I needled him. But in release, so there was that connection between the physical pain of the shoulder and the mental pain of shouldering a burden. and hitting that acupuncture point just released that in an instant, and the problem went away after that. And he had been carrying that pain for 2 years.
Hmm. Well, and I think there's something that you've touched on here, and I've come across that quite a bit in literature too, some of the stuff I've read or come across. But
Mm.
a lot of the times, it's not like a physical injury. To your point, it could be an emotional pain that we're
Yes,
having, and it's manifesting as physical pain. And the needling
absolutely.
can just allow you to open that up, right?
Yeah, yeah,
So, what's going on as far as the body is concerned when you needle that point for the individual to release that emotional pain or
yeah,
even bring it into their conscious awareness?
yeah. Well, I think I don't know. It's the memories are stored there. It's not necessarily conscious, but acupuncture often raises these things to your conscious level. Um, I was just thinking of one patient I helped who had post traumatic stress disorder, and it was a terrible situation for her because she was then an adult around 30, and through counselling had been discussing issues about her father sexually abusing her as a child, and it came out in the family. She decided to go to the police. Her mother and her sister were dead against it. They couldn't believe that their father and husband would do such things, and that she was making it up. And she went through the whole process with the police and the court case, and the father was sentenced to a few years in jail for it. And she told me afterwards she'd never have been able to cope if it wasn't for the acupuncture, which was just keeping her in some kind of balance and helping to draw the memories out and to actually clear the emotions. I, th- I think stuff can happen in our life, and we might like pretend it didn't happen, or we want to just forget about it. But the body remembers these things, and it is stored in the body where it's physically located, whether it's in the organs or in the nervous system or in the muscles. You know, you can argue these things, but the fact that they're stored there and they manifest as various symptoms, whether it's pain or indigestion or some kind of issue. I mean, getting back to the Crohn's, it took me probably about 4 or 5 years to realise that my physical problem of losing my guts was because I was emotionally gutless in a number of situations that I was involved in, and it was that realization that sort of changed everything for me, because I felt the truth of it internally. It's very hard to describe it, but a knowing, I suppose, is the best word. And that shifted, and with that shift, it meant the Crohn's never came back, and that was back in '94. And I've never had Crohn's disease. I'm not on any medications. I don't need to be on any special diets anymore, because I cleared it at that deeper level, not just band-aiding the physical issue.
Hmm. What allowed you to make that connection that, you
Yeah,
know,
that's
it,
a good question.
it's always interesting because
Yeah,
we come to these moments in our life where like the light bulb goes on, right? Like, oh,
yes,
I've been doing this my whole life, but sometimes people don't even get there, right? So I
yes.
consider myself fortunate at times to be able to have made those connections in my life, but it's crazy how it's allowed me to even get there. So I'm just curious to hear your story.
Yeah, yeah. Well, I think acupuncture is certainly one way of bringing these things to consciousness from the unconscious. But there's other methods like meditation and kinesiology, like Psych K, and the Lifeline technique. Various, um, even just straight meditating. If you're learning how to meditate properly, and you do it, these things come to the surface. It's just that we're so busy doing things, especially Western society. We think in terms of production and doing things and achieving things, and we don't actually stop and have time to just be. And acupuncture does give you that time, because literally you're lying on the bed for 60 minutes or so. And secondly, because it gets you into a deep relaxed state where it allows these things to come to the surface. People during treatments will often sense energy moving somewhere in their body. It might be in the form of like a sensation of trickling water, or it might be a feeling of waves moving through their body. And sometimes they'll see colors and patterns and images and things, but it's always brings people closer to, these deeper realizations that we're not normally attentive to.
Hmm. Yeah, yeah, I agree with you. We're kind of in a world where we're constantly on the go, not taking that time to find that sense of presence and connecting with ourselves. And I agree with you, acupuncturists, you can't really even move, right? Because you're worried
Yeah,
about needles. So it kind of forces you to remain still. And like
yeah,
you said, you're there for an hour, and there's a lot of other stuff that's going on in your body that could be bringing things to your awareness. So I
yes,
do find that profound, because I had a similar experience. I was doing acupuncture a couple of weeks ago, and I just had this realization where I was just overcome with emotion, because it just brought something to my conscious awareness that I hadn't
mm,
really connecting the dots. And yeah, it brought a lot of peace for me.
yeah,
And it's hard to explain how that even happens, but I just had a
yeah,
couple of needles in my forehead and my ear, and boom, just this something came in.
yeah. It's fascinating stuff when for me, witnessing it time after time with patients. It's
Yeah,
very powerful stuff. And I with this patient that I got off antidepressants, it's sort of my wife, who's also a medical doctor, integrative medical doctor, sort of said, "You've got to study this." So I followed 6 patients with depression over the next year using this method, and they all got better basically, and they all improved dramatically within a couple of months. And after that, most of them didn't need any further treatment, and yet, ringing them up a year later, their lives were changed. And I think that's the key, because you can take an antidepressant, but you don't actually necessarily have to change anything about your life. So all the conditions that are producing the depression are still there.
yeah,
But with acupuncture, often gives people a sense of energy and movement, and getting out and walking and doing something different, and pondering upon other things, right? On things to be grateful for rather than all the negative things in your life, things like that. It's easy to say get out and walk and start a gratitude journal or something, but depression is a learned pattern, and you sort of tend to keep becomes a self-fulfilling prophecy almost if you stay there on the couch all day long. So acupuncture actually does seem to give you the motivation to actually change and do things.
yeah. I think the other thing that happens too is being able to have this newfound awareness that may not exist. And I think that can be powerful too, because it allows you to give meaning to your life, or perhaps even the situation you're dealing with. And
Yeah,
that alone can be sufficient sometimes to just get out of that depressive cycle, where you're able to see more meaning in your life, whereas you may not be seeing it otherwise.
yeah, absolutely. Yes.
The other piece around outside of, we've talked about physical pain, but I'm wondering sometimes if you've got this emotional pain that you haven't dealt with, or it's somewhere in your subconscious, it can also result in injuries to you, right? Like in terms of physical injuries to your body.
Oh, yeah, yes. Well, and like the guy with the shoulder. But yeah, people can, like I had a problem personally of not wanting to move forward, and I literally developed a hip problem, which thank God is now gone. But that was that was more the mental holding back that caused the problem.
Yeah.
Yeah,
Yeah.
so but it's easy to deceive ourselves on these things and just think, especially when we have such a mechanistic view of the body in the West, to just think, oh, it's like the worn out hip. You just got to chuck out that part and shove in a new one, and that'll make the problem go away. But
Yeah.
it doesn't.
Yeah. No, I had a similar
Pretty
experience.
radical solution.
Yeah, exactly. Yeah, I had a similar experience with my knee, so I completely relate to what you're sharing with your hip. It's often you have to kind of take again a higher resolution view on what are you doing in your life and what are some of these injuries or what is the pain actually telling you about what you're carrying on in terms of your life.
Yeah, absolutely.
The other piece I did want to, and I think we've touched on it at the surface level, but we haven't gone into depth. But I do want to go there now in terms of acupuncture and some of the things you were sharing earlier, where you see images or you have this newfound understanding or something coming into your conscious awareness. There's
Yeah.
also a spiritual component to it. And I know when you and I chatted
Yes.
offline, we talked about this. So I'm curious to hear not only your personal experience, but what patients have also told you around how acupuncture can open up some of those
Yeah.
barriers.
Yes. I mean, I've had. I don't think it depends on a particular religious belief or not, because I've had patients who say, while they were lying there, they saw the face of Jesus. Like not as a picture, but as a real person is in front of them, and others who've seen the Buddha, and it doesn't seem to relate to, as I say, they're necessarily their religious beliefs. I was doing acupuncture on the North Shore of Sydney, which, if you knew Sydney, the North Shore's sort of upper class, very conservative type people. And there was this woman who was about 70 years of age that I was acupuncturing. And she said that she was on top of a hill and could hear this sounds of a bell, a deep bell in the distance. And she looked down and she could see a Buddhist temple. And, she was, from the description, it sounded like the Himalayas with the tall mountains and so on around her. And that she just went down to the temple and went inside and found a deep sense of profound peace and serenity. And that happened as whether you call it a waking dream or a hallucination or imagery. That was her experience, and yet she didn't personally associate with that Tibetan religions or anything like that.
Yeah. So why do you think that tends to happen? Like, again, just curious.
Yeah. I'm not sure why, but it certainly, I think, certain points in acupuncture that can stimulate various endocrine glands, and the pineal gland is one of those. And there's substance DMT, which is in
Yeah.
ayahuasca and used to produce hallucinogenic effects. And to me, it seems logical that if there's a chemical like ayahuasca or LSD that can produce hallucinations, it's because it's stimulating a receptor that exists in the brain. And if that receptor exists, it wasn't designed waiting for somebody to invent LSD. It was there because there's something within the body that naturally signals and stimulates that point. And I think that's the DMT from the pineal gland. And there's various acupuncture points can help assist stimulate that.
Yeah.
So I think that's where it's coming from. So it really does. It not necessarily a religious response, but a sense of deep peace and serenity that. It's a funny thing because you can talk about these things all day long, but when you experience it, it really can change your life.
Absolutely.
For me, the first time I experienced this was really changed my life, which was when I was lying on the bed, I could feel these wings beating. They were like 6-foot wings, and I'm flying over a couple hundred feet over a landscape, and I'm just looking around. in my mind, I guess it's one of those things because I'm thinking, oh, I know I'm not asleep, I'm awake, but I'm seeing all these things and feeling these things. And I saw a whole bunch of people down below. And then I saw a couple of people in my life who had hurt me uh, a few years before in a very painful, emotionally painful way. And when I saw these people, I realized the realization came to me that that any hurt for me was a byproduct of their drama. There was no intention to just go out and hurt me. And as soon as I had that realization, it was like a mental thought. It was like then I could a sensation of my heart opening up and a flood of love and compassion and forgiveness for these people. And then a few minutes later, I saw myself down amongst these people, and I realised I was just as fallible a person as everybody else, and I make mistakes. And so, again, I felt that sense of love and compassion for myself that I'd, was being too hard on myself, being a perfectionist type of person that I am. And that experience changed my life really. And I could have, and I had been to counsellors before, so I know the process of going to a counsellor and having realizations. But this was at such a deep level and an emotional connection that it was just like a shift that's that quick. And there was no. I mean, I could have talked for thousands of hours and not felt that feeling.
Absolutely. Yeah, it sounds like there's that sense of universal acceptance that you experience.
Mm.
A lot of people have similar experiences. I know you touched on some of the psychedelics or
Yeah.
like plant medicine, as they call them, have similar experiences when they go through those rituals of consuming those substances and
Yeah.
very similar images, right? So there is something to be said that you're saying it's activating the pineal gland because
Yes.
what I've heard often the pineal gland is like placed also where they call it the third eye, right?
Yeah.
I
Yeah.
wonder there if there's that relation there. But how does that then, in terms of acupuncture, tie into the chakra system? Because I know
Yeah.
you
Yeah.
mentioned
Well,
it earlier.
yeah. Well, now what I do, when a person comes in, I mean, I get the Western medical approach of what's wrong with you type idea as a doctor. That's still a part of my training, but then I give them a questionnaire which I've designed, which is a whole series of questions relating to the chakras. So each I ask, there's 49 questions, and there's 7 relating to each chakra, but some of the questions relate to physical symptoms like indigestion, for example, and others relate to more mental and spiritual aspects. Like I feel confident, or I feel a divine connection and things like this. And then I score them to work out which chakras have the issues. And then I've got protocols with my acupuncture to help those particular chakras that need helping. And well, nothing's 100%, but a huge percentage of the time, you know, 7, 8, 9 times out of 10, people get significant relief of their whatever their problem is, whether it's mental, physical, or emotional. So, I find that really exciting to do
Yeah.
that.
Well, and essentially, the way I've come to understand it in the chakra system, it's where the energy flow is kind of blocked, right? So you're essentially
Yeah,
releasing it from that
yeah,
perspective.
yeah, yeah. Allowing it to release. Emotions are blocked in the channels. Usually, different emotions with different organs, like anger and frustration links to the liver and gallbladder systems, and spleen relates to worrying and overthinking, and lungs to sadness and so on. So, this is all part of the stuff why you can hit a point and it releases some pent up emotion, which can happen the moment you put the needle in, or it might happen a few hours later. The patient goes home and then suddenly blows up with their spouse about some issue, which is a relatively trivial thing, but it's been something that's bugging them for years, and it releases it and it just comes out very messy. But, I usually warn patients this can happen. and to laugh it off because once it's cleared, then they're able to talk about subjects in the past that they didn't dare discuss for fear of creating waves.
Yeah. Yeah. And I mean, it's very interesting, right? And coming back around with the Western medicine system, it's not really integrated. And when you start talking
No,
about some of these things, if you're having these, uh, uh, or if you're having this awareness, how can you write it down, journal about it, whatever it may be? But it's more of an integrated approach, and kind of to your point, the mind, body, and spirit connection that we don't really focus on in the Western world. It's all, if you
yeah,
kind of go to see the doctor, it's body. And then if you go see a counselor or therapist, it's
yeah,
mind. But you're not really connecting the three.
no, no,
And it's very interesting.
yeah, yeah, and it's even today. I mean, a cardiologist, one thinks of a specialist as knowing everything about the subject, right? So, cardiologist knows everything about the heart, and yet it was back in actually 1982 that the first hormones that were produced by the heart were discovered, and since then there's at least a half a dozen hormones, including serotonin and oxytocin, are produced by the heart within the heart, and yet no cardiologists don't talk about that, and yet there's obviously with serotonin and oxytocin, there's that emotional connection. So when somebody falls in love and experiences the feeling of being in love, that's a real physical thing that's generated within the heart. And also there's the cardiac plexus, which is the nerves around the heart itself, which sends far more information from the heart to the brain than the brain does to instruct the heart. And yet nobody's been able to decode that information that's being sent from the heart. But I think, there's a lot of it is in our everyday language when we talk about a heartfelt conversation or having a heart to heart or, or being heartbroken and so on. All these words mean something and we use these things all the time. Yet, if you go to a cardiologist, the heart is merely a pump, and take it out if it's broken and you can't repair it. Take it out and put in an artificial one. That's
Yeah.
the solution.
Yeah. And it's similar to the gut, right? When people say, listen to your gut, there's that connection, the gut and the brain
Yes,
too.
absolutely. Yeah. So these things are, as I say, we all have a sort of a more or less an everyday understanding of it, but Western medicine is still pre-Einstein, really. There's no such concept of the quantum nature of the body in physics, in medicine, and that's I guess one reason why I love doing acupuncture. Physics was my first love as a young man, a student, and to then realise, okay, the body, as well as thinking of it in terms of biochemistry, which is what drugs affecting biochemistry, you can actually think about it in terms of neural pathways and electrical connections and change the body that way, which I find more fun, more interesting and more satisfying and results in deeper change for people.
Yeah. Well, you could argue that there's still an aspect of physics in the work you're doing, right? When you start thinking about how we often see similar, like, I know you're talking about the hallucinations or the images or images people will have, but there's so much overlap and commonality in it that it blows my mind that, it's not something that's out there in this physical realm for us to see or describe, but we somehow connect to it in
Yeah.
this physical way, which is very interesting.
Yes. Yeah, it just totally fascinates me.
Yeah.
And, I mean, I sort of hit upon a combination of patterns and protocols that help anxiety and depression, particularly, because I figure it's easier to change someone's thinking processes than it is to change, a diseased liver from too much alcohol. It's better to get them when they're thinking about it rather than that when the disease has hit. So, I realized a long time ago that I can't help all the people I'd like to help in the world. And so then I hit upon the idea of training other acupuncturists in this method. And for the last few years, I've been training acupuncturists in Australia through workshops. But the last year, I've been teaching acupuncturists online. So now, like US and Canada and the UK and so on are within reach, because it's fairly easy for an acupuncturist. It's fairly easy to pick up and understand in a easy program, and they're getting the same sort of results that I'm getting. So, which I find very exciting.
Yeah, yeah, that is exciting. Dr. Joannou, I've really enjoyed this conversation. Is there anything else you feel like we haven't talked about that would be of
Oh,
value to share?
yeah. Well, if anybody's interested, they could go to my website, which is stickittodepression.com. I've written 2 books on the subject, and they can get onto my mailing list just by clicking on the button. And whether they're general public or other doctors or acupuncturists, I've got information for them.
No, that's amazing. Thank you for that. And are there other ways people can find you or get a hold of you, whether it's
I
online?
am on all the social media, all the regular Facebook, Instagram, LinkedIn.
All right.
Yeah, and my website has the links to those.
Okay. Well, I'll put all of that in the show notes. But
Great,
thank
thanks.
you again for coming on here and not only sharing your journey with us, but all the work you're doing. I think it's really fascinating, and I appreciate being able to speak with you and learn a lot from you today, too. So thank you so much for all of that.
Thanks, Virkin. Thanks for having me on. It's been a pleasure.
Likewise.